The first call came at 7:42 a.m. Nathan Calloway, senior partner at Calloway and Finch, hadn't even taken a full sip of his coffee before the phone buzzed. His desk was cluttered with case files, a half-eaten protein bar, and a manila folder labeled Insurance Class Action, Draft. "Mr. Calloway?" The woman's voice was cracked with grief. "My father died last night. They wouldn't approve his surgery. I need your help." Nathan's jaw tightened. He closed his eyes, breathing in through his nose. This wasn't new. It was the fifth call this month with a story like this. Another patient denied critical care over insurance technicalities. And once again, the same name surfaced. Rhode Island General Hospital. "Tell me everything," he said, legal pad already in hand. 30 minutes later, he ended the call and sat back in his chair. The coffee had gone cold. Henry Dawson, 63, had arrived at the ER with severe chest pain. A major blockage was discovered. The cardiologist recommended immediate surgery, but the hospital denied it. Tier 3 insurance under Atlantic Health didn't qualify for the emergency procedure at their facility. Dawson was offered a transfer to a hospital 2 hours away or a wait time of 3 months for insurance approval. He was dead before midnight. Nathan flipped open the class action draft file on his desk and slid Dawson's name into a growing list of suspicious deaths and care denials. This wasn't an isolated tragedy. It was a system designed to fail the vulnerable. He was going to break it. "Eva," he said as he entered the bullpen, "put Dawson under the insurance investigation list and get me denial data for the last 3 years, procedure types, insurance tiers, approval rates. Focus on Tier 3. Eva Ramirez, his paralegal and resident document hunter, gave a slow nod. "Want me to cross-reference Atlantic Health partnerships too?" "Exactly. I want to know who profits every time someone gets denied treatment." Eva sipped from her coffee and cracked her knuckles. "That's going to take subpoenas." Nathan smirked. "I've already got a judge leaning on the class action petition. Tell him we're expanding discovery under preliminary review." She tilted her head. "You really think you'll get this into court?" Nathan pointed to the folder. "I don't just think. I've been building toward this for months. Dawson's case might be the one that cracks it open." Within a day, Eva had something. "Check this out." She spun her laptop toward him. "Over the last 2 years, Rhode Island General has denied 82% of high-risk procedures for Tier 3 patients. Tier 1 and 2, over 90% approved. And Atlantic Health isn't just their insurer, they're financially entangled. Performance bonuses are tied to cost savings." Nathan leaned closer. "Cost savings through patient deaths." Eva nodded. "Also, someone left this in a scanned memo we got in Discovery. Check the footer." Nathan squinted at the fine print. "Internal review, redacted names on approval committee." He looked up. Someone's trying to hide something. 2 days later, Nathan filed the wrongful death suit on behalf of the Dawson family. Gross negligence, malpractice, and deliberate obstruction of life-saving treatment. The hospital's response was immediate. Olivia Hayes, counsel for Rhode Island General, walked into Nathan's office like she owned it. "Mr. Calloway," she said coolly, extending her hand. Nathan didn't take it. "You here to bury the case or settle it?" She smiled. "We're here to remind you that hospitals make tough decisions every day. Your lawsuit doesn't change the facts." "You're right. It exposes them." She dropped a folder on the desk. "Discovery materials you subpoenaed." Nathan flipped through, mostly procedural forms. But when he reached the approval committee notes, he paused. A line in one of the forms caught his eye. "Final authorization, Dr. Robert Lasker, CFO, Atlantic Health." He glanced up. "Your CFO is on a medical approval panel?" "Standard oversight," Olivia said too quickly. "Every approval goes through finance." He arched a brow. "Doesn't that strike you as a bit backward?" She stood. "Good luck proving intent." Nathan leaned back. "I'm not relying on luck." That night, Nathan received a blocked call. He almost didn't answer. "You don't know me," the voice said. Female, shaky. "But I saw your subpoena. You're closer than you think. Don't stop. Watch for an envelope." The line went dead. The next morning, a courier dropped a plain manila envelope at the front desk with no return address. Inside, a printed email chain, internal memos with lines redacted, and a sticky note that said only, "Check the names. There's more coming." Eva scanned the emails. "This isn't complete, but look. Tier 3 flagging protocol, delay incentives, Q4 executive bonus review. It's real." Nathan tapped his finger on the paper. Somebody wants this exposed. Keep an eye on the mailroom and encrypt everything. 2 weeks later, as they prepared for pretrial motions, Eva pulled Nathan aside. Guess who reached out? The woman behind the leak. Wants to meet. Tonight. Nathan hesitated. Is it safe? She's paranoid. Said she only feels comfortable in person. The parking garage was nearly empty. Nathan waited on level 4, coat collar up against the wind. She emerged from the shadows, mid-40s, tired eyes, hoodie pulled low. I work in claims at Atlantic, she said, glancing around. They don't care about people. They care about balance sheets. You were the one who leaked the memos. She nodded. My name's Jane, that's all I can give. I need proof. Real names, full documents, a pattern. She reached into her bag and handed him a USB drive. It's all there. Internal protocols, emails, denial rates tied to CFO directives. They were proud of how much they saved. Your guy Lasker? He built the whole program. Before Nathan could speak again, she disappeared into the stairwell. For the next 36 hours, Nathan and Eva combed through the files. A denial algorithm coded to flag low-tier patients. A quarterly email from Dr. Lasker. We saved $6.2 million this quarter. Great job, team. Let's beat it next round. A spreadsheet marked Tier 3 defer list. Names, conditions, projected costs, expected denial timelines. This isn't malpractice. Eva whispered. This is planned execution. Nathan went ahead to amend the complaint to include fraud and conspiracy. He also contacted a journalist he trusted. By the time the news broke, Rhode Island General wasn't just facing a lawsuit, they were facing national outrage. Healthcare horror, whistleblower uncovers deadly insurance scheme. The story didn't just go viral. It cracked open a dam. Other hospitals, other patients, other whistleblowers. Nathan's case was just the match to a powder keg already packed. The courtroom buzzed with press, family members, and quiet fury. The defense came hard. Their expert witness, a clinical reviewer named Dr. Meacham, tried to undercut Jane's credibility. She's not a medical expert. She processed forms. She couldn't possibly know clinical intent. Nathan countered by calling a doctor who had left Atlantic Health last year. She's right, he testified. We were told not to recommend procedures that weren't pre-approved for Tier 3. We knew what that meant. Olivia objected. Speculation. Sustained, said the judge, but Nathan saw the jury flinch. Then he called Jane. She stood trembling but resolute. I sat in meetings where we were told we were optimizing outcomes. What that really meant was, we were letting poor people die. The defense grilled her. You're anonymous. You had access to documents you weren't authorized to view. This is revenge, isn't it? But Jane held her ground. You think it's revenge to stop people from dying? The tension peaked with Dr. Lasker on the stand. Nathan paced in front of the jury. You're not a doctor. You're a financial executive. Why were you making clinical decisions? Lasker shifted. It wasn't my decision alone. But you signed the denial. Nathan interrupted, holding up the email. And this was your performance report, based on denials. Objection? Sustained. Nathan looked at the judge. Apologies, Your Honor. Let me rephrase. He turned back to Lasker. Would you agree that denying procedures made your company more profitable? Lasker hesitated. Yes, he finally said. That was enough. The jury deliberated for 14 hours. They returned with a unanimous decision in favor of the Dawson family, $50 million in damages. But the financial number was just the beginning. Congress opened an inquiry into Atlantic Health's approval practices. Federal prosecutors launched investigations into similar cases nationwide. Rhode Island General's CEO resigned. Dr. Lasker was arrested. Nathan stepped outside the courthouse, a swirl of reporters at his back. Eva joined him, her coat pulled tight against the cold. You started something bigger than you thought, she said. He nodded. No, we finished what others were too afraid to start. His phone buzzed again. Another name, another denial. The system wasn't fixed, not yet, but for the first time it was on the defensive. Nathan Calloway wasn't done, not by a long shot.